The most common chronic illness in the U.S. is sinusitis. It affects an estimated 35 million Americans, and for some, surgery is the only way to get relief. Well, luckily, a minimally invasive procedure has now been moved out of the operating room and into the doctor's office. Local 10's Christy Kruger has details.
Have you ever wondered what severe sinus problems are like? Just ask Illich Santos.
It's runny nose, clogging. You can't breathe through one side of the nose.
We're going to take out.
After 5 years of suffering, Illich decided to undergo a surgical procedure called a balloon sinuplasty to correct the problem.
What we're doing is we're taking a guide wire, a lighted guide wire, and we're advancing it into the opening to the sinus, the natural ostia. And once we've got it in position and confirmed that, we lightly inflate that balloon at the opening of the sinus.
The surgery isn't new, but this approach is. The procedure used to be performed in the operating room under heavy sedation. Insurance carriers are now allowing doctors to do it in their offices with just local numbing.
You walk in like this is a regular office visit. You're going to come in under an hour, you're going to leave. I tell patients, maybe a little Tylenol, Motrin afterwards, whatever you would normally do, but there are no restrictions afterwards. You can blow your nose if you want to blow your nose. I mean, you can go back to work the same day if you want. So that's, saves in multiple ways.
Within minutes, Illich was already breathing better and looking forward to finally getting long-term relief from sinusitis. Now, while balloon sinuplasty is less invasive than conventional sinus surgery, the data does show its benefits are just as long-lasting. Some good news there. I'm Christy Kruger, Local 10 News.
And people at risk for developing sinusitis include those with very narrow sinus cavities and people with allergies because they are predisposed to sinus infections. It is true that most sinus problems can be relieved without surgery.
Good news for a lot of people.
Oh, yes.
Well, what a wake-up call.